Welcome to At the Table with CAHSA, a podcast that brings the people shaping California home-based care to the table. My name is Mark Wilson. Support for today's episode comes from Healthcare Synergy. Remember, technology is important, but having the right people behind it matters too. Healthcare Synergy, helping home health and hospice agencies operate at peak performance. You can learn more at healthcaresynergy.com. That's healthcaresynergy.com. All right, so I'm so happy about today's episode. It's been a while since we've done something like this. We're going to pull back the curtain today on, I think, one of the biggest reasons organizations belong to CAHSA, and that is advocacy. I know that most providers see the end result. You know, it's a new law or it's a regulation, a moratorium, a reimbursement change or something like that. What they don't always see are the months, sometimes years, of work that happen before those decisions are ever even announced. So joining us today is our friend Tanya Bautista. Now, if you don't know Tanya, she's the Director of Policy, Advocacy, and Public Affairs for CAHSA. Many of you probably met her at the conference. So today we're going to discuss some of the biggest policy victories and challenges that are facing California home-based care today. Tanya, I'm so happy to see you and that you're here to discuss this.
Yes, it's great to see you again, Mark. Happy to be here.
You know me, I love policy. I never understand it, but I do love it. So before we do anything here, again, let me just say, I think one of the greatest membership benefits of being a member of CAHSA, beyond the networking and the amazing educational programs, is having somebody fight for providers every single day. And again, I know that providers don't see the hundreds of meetings or the negotiations or, you know, the coalition work and the legislative efforts that happen behind the scenes. And I think sometimes if members only hear about a new law after it's passed, you might be missing some of the value that CAHSA provides every day. So, Tony, before we get into some of the legislative, some of the policy stuff that you've been doing, I wonder if we could just sort of broad stroke. I mean, when people hear advocacy, what does that actually mean? And what does your typical work week look like? So we get a sense of what you do.
Yeah, no, I'm happy to answer that question because it's not always as visible as I would like it to be to members. So from that perspective, it's something that I'm really trying to, improve and work on. We have our weekly news updates that go out every Monday. That is driven by my role. And so I make sure that we're including pertinent updates on legislation, active regulations, as well as any other industry news. But in addition to that, I provide updates on what I'm doing in terms of the work we're doing through our state advocacy work and our federal advocacy work. So there's a lot to consider when we look at the weekly news updates, and I see, there's a lot of engagement there. That tends to drive a lot of questions from members to me. And so that kind of takes me into another area that I provide members with, which is answering questions, providing technical assistance around, not only what's happening right now, but what's in place, really making sure we have a deep, robust understanding of how to implement regulations, how to implement statutory requirements. And then if there's anything they need for me to take back to state departments, by way of, maybe some survey experiences, some billing issues. That's a role that I play is really providing that liaison opportunity with Department of Public Health, Department of Healthcare Services, Social Services, ad infinitum, if you will. And lastly, just to really think about what I do on a weekly basis, I also am constantly planning and mapping out what is the best strategy for us in the long term to really ensure that vision of having home care at the heart of healthcare is what we achieve through our advocacy and policy work. So that being said, to really understand what that looks like, we have to look at the legislative calendar. We have to consider, where do we need our legislative champions to do some support for us with bills. And then, of course, we have quarterly meetings with the state departments, really planning for meaningful engagement there. Um, and this has been a big year, Mark. I just have to say, there's a lot going on right now that I think is um, very opportunistic and rewarding for CAHSA in terms of seeing changes that needed to be made, pretty much in the last for a decade or more. And then there's also some, fires that we got to put out and we got to address. And so we're often looking at all of that right now.
Again, I'm just curious about, and this isn't so much for people that have been in CASA for a long time. I know there's some new members, and like, who are you meeting with in Sacramento? Because I mean, that's part of your work on a weekly basis. Who are you meeting with regularly?
So it was really exciting this week because we got to meet with Senator Menjivar, and we had to sit down with her, had some appetizers, and we had a good hour just to talk with her about home care. So we're always looking to continuously have that level of engagement. And Senator Menjivar is just an amazing. She's been such a huge champion
Yeah,
for
yeah.
CASA and home care. Um, but that being said, we have a constant flow of engagement with the State Department liaisons who are, actively working on regulations and other, set guidance. And then we engage, at the federal level. We do a lot of work with making sure that we're connecting well with Alliance and other important partners, streamlining, messaging and ensuring that there's a consistent approach for the industry to allow, for our voice to be heard at all the tables.
So just hors d'oeuvres, or were there cocktails involved too? Just
There were
kidding.
cocktails. I had coffee, to be fair. I had to go pick up my daughter from soccer practice afterwards.
Okay,
So
good for you. I just had to ask. I'm sorry. That's a little
yeah.
nosy, little nosy from me, I guess. Okay, thank you for sort of laying that out for us about basically what you do during the week, a typical week for you. I want to jump in real quick because I'm so proud of you, and I'm so proud of CASA, and I'm so proud of California. The PDN success story. Can you sort of take us through that?
Yes, that's been one of the most rewarding experiences I've had this year with so that's the private duty nursing uh state budget investment that we were able to secure this year. So we had a multi-million dollar investment in private duty nursing for and this was a huge win for CASA and the PDN Coalition that's been actively working on this since basically right around 2017. And with the coalition work, I mean, we were engaging in SAC-B ads. We had a highway bulletin that was, launched, and we did grassroots advocacy, brought in our members. They were sending letters out, really encouraging everyone to understand the meaning and the purpose behind the state investment and actually how it saves the department money or saves the state money. And so when we saw that the governor had signed it into the budget, I mean, it was just an incredible experience,
Yeah,
and we were so grateful.
yeah, Tanya, would
Mhm.
you tell us what the legislation actually accomplishes, what it actually does?
Yes, certainly. So when we look at that investment from the state, it trickles down to our agencies in ways that allow them to expand the workforce by having a rate increase for the private duty nurses that provide the home care services through home health. And this is focused on pediatric supports. I do want to caveat that component because, the big messaging throughout this year has been that this is to bring children home from the hospitals, make sure that they get the care and they can be in their homes with their loved ones in their community, and be able to thrive while receiving that private duty service, which is critical in terms of what our agencies can provide, what home health agencies can provide, but it's been so difficult, uh, given that the current rates are not competitive against, hospital rates. And we all know that there's a nursing shortage. I mean, that's a national issue, is the nursing shortage. So for home care to be able to compete effectively, and ensure workforce for private duty nursing, which translates into services, of course, with children, who are just have complex medical needs. That's where this investment goes.
I
That's
mean,
what that translates to.
yeah, when I first heard about this issue, it just seemed like a no-brainer to me. And I get it. The state's going to have to spend a little more money this year in order to save money the next year, but they don't necessarily look
Yes.
at the next year
Mhm.
when they're considering the budget. So it's, it's typical for me, typical like government. It doesn't make sense to me. And I was, fingers crossed like everybody else was. And just so, I mean, it was such a celebration after we saw that it went through because
Mhm.
I don't think anybody really knew whether it was going to happen or not. So for you and CAHSA and everybody else that worked on this, congratulations, great work. And, it never made sense to me that kids staying in the hospital would save the system more money than
Mhm.
letting them be at home and get taken care of at home. And how much better is that just all around?
Yeah, absolutely. I mean, and the level of work we had to engage in terms of the education behind that, was a big effort. I mean, we really had to make sure that everyone had the resources. When we go back to like our lobby day, for example, that CASA hosted, this was one of the items that we went into all the offices and we sat down and we explained to all the staffers and members, what does this really mean? What does this look like? And just providing that human conversation is an important step in what we do with our advocacy, because it's not just about sending
Yeah.
emails and flyers. We really get into the rooms with them and have these conversations to make sure they really can see the impact and understand, uh, who it is that's providing this service. This isn't a money grab. This is really
Right.
trying to ensure adequate workforce and supports. And then, of course, honoring that we want to save the state funds, for other important opportunities.
Well, and there's nothing better than telling stories, and you get an opportunity to tell those stories. Do you think Lobby Day then was a big part of the success of of getting it done?
Absolutely. And I think, to provide one caveat to that is this was, the first time in a few years that we've done in-person,
Right,
lobby day.
right.
So, yeah, so we really brought together, major industry leadership, and we divided into teams of 4, and we just hit as many offices as we could that entire day. And yes, I would say that was incredibly effective. And really, actually, I should also say it was beyond just the PDN rate. Some of the legislation that we also discussed beyond the PDN rate has, had success as well. So we had major wins as a result of our lobby day work,
Well,
certainly.
maybe this is turning into a big commercial for CASA, and I really didn't mean it to, but isn't that the whole reason that CASA exists? It's all kind of people coming together in one voice and showing up and being heard, and that's what belonging to CASA means. That's you can get things like that done when you've got multiple voices that are speaking as one. So again, congratulations to everybody, including the membership that went to Lobby Day. That tells you the rest of you that didn't go next year, right?
Yes, exactly. And that's the thing too. It's like when you think about what we did earlier in the year for Lobby Day and how now, we're in mid-August. This is where we get to constantly check in every month and be like, see measurable results. And especially seeing how, we have CASA 3.0, and we've, come to a place where our voice and our mission, our objectives are designed in such a way that it translates very effectively to our advocacy work. And, again, I mean, the fruit of that has been huge.
Yeah, awesome. Okay, let's move on to the home health agency moratorium. What's going on?
Yes, so we did see that Senate Bill 156 was passed here in California, and that did establish a home health moratorium, so a state-based moratorium. There's also a federal moratorium that's in place, but that's a shorter term one that should be lifting hopefully in the next couple months at the end of September. But for the state moratorium, that one is set as indefinite until the Department of Public Health promulgates updated Title 22 regulations for home health. And, that sounds um, like a loss to CAHSA, but where we've been at this entire time is at the table with CDPH, identifying the areas of focus that they want to put into Title 22 as an update. And then we have been actively working together as members. I've been leading a work group to develop a reg package that we will be presenting to CDPH, which CDPH knows we're doing. They've requested this from us actually, and we are eager to provide all the updates based off of SB 156, the requirements that are established in statute, as well as some of the industry trends that we're observing across the board for governance and oversight. We certainly want it to be meaningful, especially in terms of addressing fraud, waste, and abuse and staying ahead of that. And then in addition to that, making sure we're establishing standards that align effectively with all those who are just doing amazing work across the state and providing, the necessary services to allow people to stay at home and be in their communities. So, the regulations, we just met again as a work group yesterday, or sorry, on Tuesday, actually. Yesterday, I had a hospice steering committee. So I should also explain that I provide oversight for several steering committees with CASA that allows members to engage in our advocacy journey and set some of the priorities and concepts. And so that being said, yeah, the home health Title 22 work group has just been incredible in terms of what we've been able to achieve and discuss and, start to draft.
So let me ask you this. Have there been areas where CASA, where you in particular have had to push back on the state's assumptions or implementation with this moratorium?
Yes, absolutely. And that can really honestly take us back to our annual conference. At that time, the hospice regulations, emergency hospice regulations were relatively new. We were still processing them, and CDPH, the Department of Public Health, sent liaisons to our conference who were able to provide a session where members could talk and discuss with them and non-members, those who registered for the conference. Um, from from that level of engagement that CASA was able to provide with stakeholders, we developed, a list of questions that we've been working through with CDPH directly and really trying to build that transparency from what the state is trying to accomplish to, what they're willing to consider for amendments with emergency regulations. And I would say that CASA has been at the forefront of leading a deeper understanding for these government agencies in terms of what it is that is really happening on the ground with agencies and how they truly operate in such a diverse and unique way that we really need to make sure the regulations sustain all these models of care that are productive um, and CDPH, I would say public health has been extremely receptive to all our suggestions. We actually just met with them again last Friday for a quick check-in on the progress of the hospice regulations as well as the home health. And it was great to just kind of engage with them on what their objectives were and how they were trying to achieve them, and us providing a little bit more feedback on how to better align, that vision that they may have had with what the regulations and how the industry should interact with them.
Okay. Let's move along since we have limited time. I could talk about this stuff forever. You
Yeah,
probably could.
same.
You probably do feel like you do
I do.
forever.
I dream about it. I dream about it, Mark.
Okay, let's move on to the new CMS rules. What should providers be paying attention to?
Yes, there's the new hospice rules that have come out from CMS, and then we actually have proposed rules for home health as well.
Right.
So, we're really trying to toggle both of those effectively and provide the guidance. But with hospice in particular, that just came through recently, there's a lot to consider there. They have a new index that has new standards and measurables that can put hospices at risk of being basically a red flag to CMS. So those are the things that we are providing additional guidance around at the CMS level. We have this index, we have some new standards that they need to prepare for. So even though there was this rate increase, that we got to see from CMS, which we were excited for. It may not have been as high as the industry needs, it's still, positive. There's a lot of provisions that were put into the CMS rule that could, put hospices at risk for whether their business will be viable or not. And I'll give you an example with the new SSVI, that's the index I'm referring to. Um, it has measures in there for non-hospice spending that it can take you and that's not controlled by the agencies. Many of them aren't even aware of what their non-spending is for the patients in care. Yet they're being held accountable to that, and they're getting points against them based off of non-hospice spending. So there's so much advocacy to do in this space, and CAHSA's at the forefront with the Alliance. Really making sure everything's as clear as we can make it. I do wanna also share that in our hospice, steering committee meeting yesterday, we talked about this at length, and we plan to do a quick survey check-in with our hospice members, make sure that what their level of awareness is of these updates and these changes, and even seeing, where they are at in the, recent, publication of the index and how we can provide some supports to lower their number if needed. But we really want to provide some real case studies and show, be able to show CMS this is what it looks like. These are fantastic providers, and especially the big agencies, they're going to get hit hard with that non-hospice spending. So we're going to start moving forward in a proactive way to support these provisions effectively.
Okay, let me step down here real quick and make sure that I thank our sponsors, supporter for today's podcast. That's Healthcare Synergy. Running a home health or hospice agency today, it's not getting any simpler, is it? And that's why providers are turning to Healthcare Synergy. For more than 30 years, Healthcare Synergy has helped agencies operate more efficiently with powerful EMR technology, clinical services, billing and revenue recovery, and the expertise to help you navigate an increasingly complex healthcare environment. Technology is so important. We all know that. But guess what? Having the right people behind that technology matters too. Healthcare Synergy, helping home health and hospice agencies operate at peak performance. You can learn more at healthcaresynergy.com. That's healthcaresynergy.com. Okay, I have to ask you real quick, and I'm hesitating on whether I'm going to ask you this. If I'm a provider, can I ask you a question? How do I get a hold of you? I mean, do you know what I mean? Are you accessible at all?
Yeah, that is so important is that providers feel they can reach out to me anytime. I give my email, which is just we kept it really simple, policy@casa.org. That goes directly to me. I will see everything. People can also call me, and I'm happy to provide my number to anyone who requests it, certainly. And from that perspective, I'm basically on call for all members. I want to be available and discuss whatever they need to do.
And that's whatever. Right? And don't be afraid, because when I
Mhm.
listen to you talk, I go, wow, she's kind of nerdy about knowing all this stuff, and I'm not sure that I would even ask the right question. So nothing off. I mean, whatever question they have, right? That's good.
Yep, exactly. I mean, I'm happy. I'm here to support and ensure the success of everyone in this industry. I mean, I have a deep personal belief in why
I
there's a
know you do.
value for home care.
Yeah.
And when it comes to, the advocacy side of things, I do nerd out on it. Certainly there's been so many hard fights, which I get excited to be in the middle of, because I know I can provide a model and a voice of reason in those discussions and at those tables. That being said, the more I hear from everybody and the more I engage with them, the more I'm able to represent effectively.
Yeah.
That's just the truth of it.
That's awesome. Okay, I have, just before we go here, you're on the inside. I mean, you see a lot of things that a lot of us don't. And I know you report a lot of it out, as much of it as you can. Tell us, in your mind, what's the one thing providers should prepare for before this year ends?
One thing, my goodness, it's definitely to look at their policies and procedures and update their manuals. I mean, we just can't underestimate the value of that resource, especially when you're doing surveys and you know that surveyors may not be that consistent with their policy interpretations. Um, that's a tool that will equip anyone to be able to, walk through that process and provide the feedback and um, really point out where things can align effectively.
Okay, great. Thank you. And thank you, Tanya, seriously, for helping us understand that advocacy isn't something that happens somewhere else. It's happening every day on behalf of California providers, and you are leading that with CAHSA, and we appreciate that. If today's conversation reinforced anything, it's that I think strong advocacy doesn't happen by accident. It takes relationships, which I know you develop on a day-to-day basis, expertise, persistence, and a united voice, and we talked about that. If you're already a CAHSA member, thank you for making this work possible. It takes people together to make this happen. And if you're listening to this or seeing it and you're not a member yet, today's conversation maybe is a great reminder of the value of having experienced professionals represent the interests of home health, hospice, and just home-based care, private duty providers throughout California. So to learn more, if you'd like to learn more about CAHSA, go to CAHSA.org. That's CAHSAH.org. And if you like what you heard today, don't forget to subscribe to At the Table with CAHSA, wherever you get your podcasts. If you don't like what you heard today, go ahead and subscribe anyway and like us and tell your friends that you didn't like it. Finally, thank you for listening and watching. Special thanks to Healthcare Synergy for supporting this podcast and for supporting home care providers across California. Tanya, you want to leave us with any particular thought?
I would just say, even non-members, reach out to me at policy@CAHSA.org. I'm happy to discuss like what is the benefit that you'll receive when it comes to advocacy and our public affairs work. I'm always, like you said, I'm a big nerd about this. I'm always happy to chat and really just be able to communicate directly with anyone. What is our long-term objectives? What are our short-term actions? And how that'll be a benefit to them.
And I didn't mean to call you a nerd.
I like it.
It's
I'm
just
fine
you
being
are
called
one.
nerd.
Okay. Tanya Bautista, CAHSA's Director of Policy, Advocacy, and Public Affairs, thank you so much. For everyone at CAHSA, I'm Mark Wilson. Thank you for listening, and we'll see you next time at the table.
Thanks, Mark.